If you or a loved one have gone through a cancer treatment, you know that the effects of it, and you're going to feel so many different things, many different ways about many different things, including your body and sexuality. So if you're a younger person, many times these physical and emotional changes are not being talked about, either with your health team or with your partner.
Thinks about cancer in young people, but 70,000 young people are cancer survivors, and we're talking 18 to about late 30s, very specific age group. And this is the age group that we're talking the college years, the dating years, the marriage years, the starting of family years. It's not supposed to be the cancer years, but it is. It is for a lot of people. And all this other stuff kind of gets swept away while they are dealing with survival. But they are surviving. That's the good news, is we have a huge number of young men and women who are surviving, and we really need to look at quality of life. Now, one of the things that's interesting is there has been an emphasis on reproductive future in many of these young men and women, and there's wonderful programs. Northwestern has one where you can freeze eggs and freeze sperm before you go through chemotherapy so that they will be able to have families later. But there's a difference between reproductive health and sexual health. Because it's one thing to have sperm and eggs that are good to go, but what about dealing with the emotional, physical, hormonal things that make people have a normal sexual response? And no one has been talking about it. And these young men and women feel so isolated because they're, I mean, in their 20s, it's, you know, sex. Everyone's having sex all the time, right? And they're thinking,
was that what's supposed to happen in your 20s? I must have
did you miss that?
I must have. Oh, 30s, I'll re-rally.
Exactly. It's not too late. But they really feel isolated. And the other thing is when you go to the doctor very often and you're 18, 19, 20, and you have the support of your parents, which is great. But you're not going to open up the conversation with your mom and dad sitting there and saying, okay, and my vagina's dry, or I can't maintain an erection. And the doctor, more often than not, we know, doesn't bring it up. So there is a group at Northwestern that has rallied around to say, wait a minute, you need a safe place where you can talk about all of this, where you are with other people. No one gets it except the people who have been through it. And so they wanted to really gather them together and not only have the opportunity to talk about it and share their experiences, but to get some experts in there. So this specific event, I'm going to be there, of course, talking about female sexuality. And then my counterpart, Dr. Nelson Bennett, who's a male sexual health expert at Northwestern, my counterpart, he's a urologist, and he's going to be there to talk about the guys. And really, it's you know, it's going to be cocktails and fun, and it's not just for the young men and women who are survivors. It's for anybody who wants to be there for them, their partners, their friends, their spouses, because we are trying to open up this taboo topic, have the conversation, and say, yeah, we're going to talk about your orgasms. We're going to talk about your libido. We're going to talk about all those things that I'm not supposed to be talking about on morning TV. But it's so important.
So how can family and friends gather around and open up? Is that what you do? You open up the conversation?
Essentially what we do is we start by just giving some information, because the information is not out there. Acknowledging, yes, this is a problem, and there are solutions. And if your doctor or healthcare provider has not given you solutions to your lack of libido, your lack of feeling, your lack of ability to deal with these things, that doesn't mean there aren't solutions. And when I wrote my book, Sex, RX, Hormones, Health, and Your Best Sex Ever, it was directed exactly at that, to say there are solutions out there, we can help you. A lot of times when you're a cancer survivor, you think, okay, I should just be grateful to be alive. And I shouldn't complain about things like I have no sex life, I'm not dating, I don't want to take my clothes off because of the changes that have occurred because of my cancer treatments. And no, you get to complain about that stuff. And we're here to fix that stuff. We're here to help. We have a new center opening at Northwestern, the Center for Sexual Medicine, that I'm the medical director of, and I'll come back and talk about that later because very excited. But these kind of events are exactly what we want to do, to say there are physical, hormonal, and medical challenges even when you're young, and we can help. The other group that also is not addressed that we're really focusing on, there are childhood cancers. And they might be cured of their cancer. They might be cancer-free of the cancer they had when 9, 10, 11. But there are repercussions. And when we talk about survivorship in this group, it's so different, because when you talk about survivorship in someone who's 60 or 70, who's had cancer, let's face it, we're not talking about 40 or 50 years, we're talking about 10 years, 5 years. But when they're 18, we are looking at the very long picture.
I think that you bring up such a great point, and if people can't go to the event, I think it's a matter of if your partner's dealing with sort of thing, if you feel the need maybe to talk about it, or at least open the dialogue to let them start talking too, because they may feel uncomfortable. It might be one of those situations where you're both kind of thinking the same thing, but if you can at least open that door of dialogue and start
And it's
talking.
an easier conversation than you think. In fact, the person on the other end of the conversation is like, thank God.
Yeah.
Thank God we are
Right.
having this conversation.
Right.
Well,